Hi, everybody, and welcome to Health-ISAC's Quarterly Threat Insights webinar. I'm Errol Weiss. I'm Health-ISAC's Chief Security Officer, and I'll start things off with a few quick remarks before we dive into today's threat briefing. For those of you who may be new to us, Health-ISAC is a trusted community of critical infrastructure owners and operators in the global health sector. We're a member-driven organization, nonprofit, that's committed to sharing timely, actionable intelligence and fostering collaboration to strengthen security and resilience in the health sector. Today's session is open to all interested stakeholders and is being conducted under TLP White protocol. That means that the information shared here today can be shared publicly. We are recording today's session and the playback will be available on the Health ISAC website. The goal of the quarterly threat insights is to provide a current snapshot of cyber and physical threats facing the healthcare sector. After each speaker, we'll pause to address any questions. So feel free to submit yours at any time using the GoToMeeting questions panel. For our Health ISAC members, please note that the webinar does not replace our monthly threat brief. Instead, this session is designed to complement it by sharing high-level, actionable threat insights with a broader health sector audience. So with that, I want to begin. But before we actually really get into the threat brief, I want to take advantage of a visit that we have going on this week at Health ISAC's Threat Operations Center. So joining us, I'll ask Erwin to open up. There's Erwin, thanks. So Erwin Savage is from Regeneron, and we have the privilege of having him and his team visiting with us at Health ISAC's Threat Operations Center in Orlando this week. And we've done a number of these where we have members come in, spend a couple of days with our staff and exchange ideas. We learn from each other, and it's all about helping each and everybody else out. So Health ISAC, we get better by understanding what the members are doing with the information that we provide, what tips or tricks that we could do to make things better. And likewise, we hope that Irwin and company will leave from their visit knowing more about Health ISAC and knowing what else they can take advantage of. So with that, Erwin agreed to pop on the call here today. So I just want to spend a couple of minutes with him. And I want just to ask a couple of questions. First, I'll ask Erwin, so what was some of the highlights from the visit this week?
Thanks, Errol. Yeah, pleasure to be here. Highlights, honestly, probably just meeting the team. What you've kind of built out here in your Orlando office it's pretty good. I think there's a cohesive team. Everyone's friendly. Seems like for myself, selfishly, I'm leading CTI within Regeneron. I've identified an awful lot of links that I can kind of bring back to wider team, right? Not just the cybersecurity aspect, but data privacy, intellectual property, and some of our business resiliency, physical security themes, and just kind of, I suppose, how can I expand that? And just those conversations kind of start to free flow when you're, in a threat operations center like you've created down here. So it's really been a privilege. So thank you to Zach, who's on site, and the great team that you built down here. So really good.
That's great. So it sounds like being able to get, not just cyber threat intel and cybersecurity involved at Regeneron, but other parts of the organization as well. So that's terrific. What's maybe one of the number one items you're taking home for your own team to work on?
Yeah, I think I've probably, it's unfortunately one thing is a bit difficult to try and just narrow down on. I have probably made an extensive list, and I will say what you've kind of prepared from an engagement documentation, is phenomenal. I mean, coming in, having a very dedicated, structured, day really helps kind of coordinate the questions you might ask, help you kind of dive into those specifics a bit more. And for myself, and I'll generalize this, is playbooks. I think there's a lot more playbooks we can kind of create in cohesion with H-ISAC and some of the members, specifically around items pertaining to how we might better share our data, right? We have an awful lot of threat intelligence data that we have internally, and there's a bit of abrasiveness to be able to share that, some of the items that we want. So kind of my biggest takeaway is how I'm going to engage data privacy, have them engage with H-ISAC, and then build that into my own internal documents so we can have kind of more real-time data pushing into the members.
That's terrific. Well, again, thanks a lot for joining us here on this presentation, and really glad you had a successful visit with the team there in Orlando. So thanks again, Oren.
Absolutely. Thank you very much. What a pleasure.
Okay. So Nicole, we can go to the next slide. We've got a really packed agenda today, and that was sort of an added plus. So again, thanks, Erwin, for that. Um, some of the uh, activity that we are able to actually highlight this month on this quarter is taking a look at an article that will appear in Health-ISAC's next quarterly health sector heartbeat report. So Tyler will give us a little snippet of that report. And then I'm really excited to hear from Taylor on an update on nation states targeting medical device software. So I'm going to hand it off right now to Zach Nelson, and he will begin to take a look at the cyber threat level. So over to you, Zach.
Hey, thanks, Errol. Like Errol said, my name is Zach Nelson. I'm the Vice President of Health-ISAC Threat Operations Center. Don't let Erwin fool you. I've also learned a tremendous amount from him. Also, the fact that there are few people wearing many hats and doing so much with what they have available to them. Some of the stuff that they've showed me around detection rules and data analytics and things of that nature has been tremendous to learn from. And so I think we're going to learn a lot from that I'm also going to emphasize more of here at the Threat Operations Center. So thanks for that, Erwin. So ultimately today I'd like to briefly review the current Health-ISAC cyber threat level and then emphasize some of the recent takeaways that the health sector has faced over the last month. So let me get started with that. So the Health-ISAC Threat Operations Center, we meet with our it's an amalgamation of a lot of different members. They're known as the Threat Intelligence Committee, or the TIC, and we discuss the overall cyber threat level. Some information is discussed at TLP Red, some TLP Amber, some other things that are going on in the broader health sector, and that's what I'm here to discuss today. Surrounding those threats and their potential impact to the overall health sector. So throughout that meeting, the discussions that were held, and we'll get into why in a moment, but we decided to lower the threat level to blue or guarded. It was yellow or elevated last month. And it's due to a few key threats we've observed throughout the last month. And while the overall tension has decreased in the Israeli-Iran war, these areas still warrant our attention. So let's dive into some of the specifics concerning Israel, Iran, and some of the other geopolitical things that Ethan Muntz, our strategic intelligence analyst, is going to get into in a moment. We're still seeing cascading cybersecurity impacts from the Israeli-Iran war. And while the direct war is no longer active, the residual strain and tensions between the US and Iran has led to increased targeting of US and other critical infrastructure by Iran nexus threat actors. And although the threat to the health sector is not as high as it was during the active conflict, the heightened risk to critical infrastructure owners means we must remain vigilant even in this downturn. At any moment, it could definitely pop off once again, and we do need to be ready for some of the events that come out of or potential impacts that come out of those geopolitical events. Something that is continuing, this is a continued observance from our TIC members, is remote IT worker fraud. And so there's been observances of fraudulent remote IT workers attempting to gain employment in their organizations. You may have heard this ad nauseum, it may be new to you, but Health-ISAC encourages the cybersecurity teams out there to work closely with HR and talent acquisition teams to discuss best practices and identify inauthentic individuals before they gain employment and potentially compromise your systems. The next thing that was brought up out of many, but we're just focusing on the top 5 here, is the TIC also brought up observances of a rise in QR code phishing campaigns, often referred to as quishing emails. Threat actors are delivering malicious HR-themed documents to executives with communications about policy updates. These malicious QR codes are embedded directly within the email body and designed to bypass traditional security appliances. In some cases, threat actors are even spoofing targeted individual email addresses to successfully deliver these QR codes. So upon scanning, users are redirected to a credential harvesting site designed to steal sensitive information. We here at Health-ISAC strongly recommend educating end users about email security best practices. So within your overall hygiene programs or your security awareness programs, whatever you like to call it internally, we highly recommend that you make your end users aware of these QR phishing or these QR codes and the phishing attacks that are associated with them, so they know what to look for and what they should do with those emails in order to report those to the appropriate teams within your organization. Another common theme throughout the year 2025 has been job posting scams. This was discussed with the Threat Intel Committee as well. These threat actors are abusing legitimate company branding to impersonate organizations on job postings, and they often leverage these bogus postings to trick applicants into sending money for equipment under the guise of reimbursement and to extract personally identifiable information. This is an ongoing threat. It poses significant risk to both individuals and the reputation of the impersonated organizations. And then finally, there's file fix campaigns. TIC members have observed a substantial amount of these campaigns. These campaigns are a variant of the previous click fix campaigns, which leverage social engineering tactics to manipulate users into executing malicious commands via the File Explorer address bar or a benign HTML as an executable. The goal of these campaigns is to deploy remote access Trojans or RATs for follow-on command and control activity. Again, we can't give you a problem without giving you a recommendation, so we do recommend that members prioritize user awareness training yet again and hardening on endpoint detection devices to mitigate this threat. With that being said, that kind of closes out the 5 high-level items out of the many things that were discussed on the recent call last week, and I'll hand it back over to Errol unless there's any questions.
All right, great. Take a look at the questions queue. Nothing in the queue there. So again, if you do have a question, you can enter it into the questions panel. And with that, thanks, Zach, and we can go to our next speaker. Over to you, Tyler.
Thanks, Errol. So hello, everyone. My name is Tyler Curry. I'm a CTI analyst with the Operations Center here at Health-ISAC. As you can see here, I'll be talking about some trends in cybersecurity. I know earlier we kind of hinted at the health sector heartbeat document that basically provides observations of ransomware, cyber trends, amongst some other things across the threat landscape. But with respect to some of those trends, I'll be talking about daily DNS records that was brought to our attention that we've actioned over the past quarter. Next slide, please. All right, so daily DNS records pose a threat to health organizations due to the ease with which threat actors can exploit unmanaged DNS records through a process referred to as subdomain takeover. Subdomain takeover simply occurs when a DNS record, often a CNAME record, points to a resource like a cloud service, an old server, or a third-party service that has been decommissioned or is no longer under the organization's control. That reports the dangles that we're referencing. An attacker or threat actor can then register or claim the abandoned resource, effectively taking over the subdomain. As you can imagine, for health organizations, let's say the subdomain is research.hospitalname.org or patientportal.clinic.com, that can lead to that being taken over. The takeover of a DNS record can disrupt critical operations and also erode patient trust, which could ultimately inflict lasting brand damage. Next slide, please. So in response to the recent surge of information that was brought to our attention at the Operations Center, regarding dangling DNS records associated with both members and non-member environments. We at Health-ISAC distributed a bulletin educating the wider community on the issue. In addition to distributing the bulletin to all members, target alerts were delivered to nearly 400 organizations with dangling DNS records. Recipients of target alerts have replied to us at Health-ISAC expressing gratitude and communicating that the reference record has now been remediated. The team will continue to deliver alerts for abandoned records to decrease the likelihood of a threat actor successfully hijacking a subdomain through the subdomain takeover attacks previously mentioned. Next slide, please. So as moving forward or look forward, the team will, as I mentioned, continue to deliver the alerts and related to member organizations and infrastructure that appears abandoned and vulnerable to takeover by threat actors. So thus far, the target alert and bulletin initiative has led to a 50% decrease of dangling DNS records, which is a risk of, as mentioned, the takeover by the threat actors. The team will continue to educate the health sector community on this exposure to mitigate organizational risk and to ensure the delivery of patient care and minimize disruptions to any operations. And with that, I'll pause for any questions and hand it back to Errol.
Okay, Tyler. Thanks for all that. Just double checking the questions. We're working on one right now, but I don't see any other questions in the queue for you. So we can go to our next speaker, and that's going to be Taylor Porter. Taylor.
Hi, thanks, Errol. My name is Taylor Porter, and I'm the Medical Device Security Analyst at Health-ISAC, and I'll be presenting on SilverFox targeting medical software. Next slide, please. So SilverFox is a Chinese APT that's been active since 2024. The group may also go by the name as Void Archine or the Great Thief of the Valley. SilverFox initially targeted various Chinese-speaking organizations, but has since expanded to several sectors, including government, e-commerce, finance, and the health sector. To conduct their attacks, SilverFox distributes malware through various channels such as SEO poisoning and social media, usually disguised as AI applications or VPN software. Malware samples from their campaign originated from both the US and Canada. They have been known to target DICOM viewers and utilize a multi-stage campaign. SilverFox uses both Valley Rat, or also known as Windows 4, in their arsenal to conduct attacks. Next slide, please. There's been 29 malware samples that were identified between July 2024 and January 2025. The samples appeared to be legitimate DICOM viewers, but deployed Valley Rat backdoors. They used SEO poisoning and phishing to propagate. The first stage of malware is disguised as a legitimate software. The executable conducts Alibaba Cloud Bucket and retrieves encrypted staging configurations, ensuring persistence. The second stage malware loads a dynamic link library containing injected code designed to evade debugging. Stage 3 is a payload with deployment and persistence, decrypting and executing Valley Rat Trojan, which allows the attacker to maintain remote access. There's 2 additional payloads that are delivered, including a keylogger and a cryptocurrency miner. Next slide, please. To defend against SilverFox, the following is recommended. It is advised to avoid downloading software files from untrusted sources. Some medical devices are provided with DICOM viewers to healthcare customers, so there is no need to download a separate DICOM viewer. Organizations should prohibit loading files from patient devices onto healthcare workstations or other network-connected equipment. To implement strong network segmentation to reduce the risk of an attack spreading across the network, and additionally, ensure all endpoints are connected and continuously monitor all network traffic and endpoint telemetries for suspicious activity. And that's all for the section. If there's any questions, I'll pass it back to Errol.
All right, Taylor, thanks a lot for all those updates. No further questions. So really good advice on protecting medical devices. So thanks for all that. We're going to go next to Ethan Muntz, who has several updates in the geopolitical area. No doubt that we'll see some ramifications in cybersecurity for organizations all over. So Ethan.
Thanks, Errol. Hey, everyone. My name is Ethan Muntz. I'm a strategic threat analyst here at Health-ISAC, and today I'm going to go over some of the geopolitical risks that we're seeing in Q2. Next slide, please. So to hop into it, kind of want to build off of what Zach was saying earlier in the webinar. So the Israel-Iran war, a ceasefire was announced on June 25th. However, that does not mean that a ceasefire has been enacted in cyberspace. So because of that, the residual tensions are being expressed through cyber means, meaning that these tensions are still very real, causing an increased risk to critical infrastructure owners, especially when it comes to risks from hacktivists. Hacktivists or hacktivism campaigns tend to target critical infrastructure owners as part of larger campaigns to target a country. So if, for example, Iranian sympathetic hacktivist groups wanted to target Israel, they would target Israeli critical infrastructure to as a show of force. And healthcare is in that umbrella. So healthcare organizations are being explicitly targeted by hacktivists as part of these larger campaigns as recently as July 20th. So July 20th, it was announced that a Iranian hacktivist group, the Cyber Islamic Resistance, they targeted at least 9 Israeli hospitals. These hospitals included mental health hospitals, trauma centers, and concerning enough, even children's hospitals. So in addition to the cyber ramifications, there's also a couple avenues for continued escalation. There are currently missile strikes going on in Syria and Yemen. This is straining tensions further in the region. There is also Iranian threat actors targeting US and Israeli critical infrastructure and incentivizing their affiliates to target US and Israeli critical infrastructure by offering them an increased profit share of any profits that they would have made. Next slide, please. On the Russia-Ukraine side of the house, the US has proposed a major weapons package delivery to Ukraine in the event that Russia does not make a deal in 50 days. This is really providing a ultimatum to the point where the weapons package described was to be in the billions with joint funding from the US and EU. And it was mentioned that the weapons being delivered were going to be advanced in nature, possibly turning the tide of the war. So this is definitely a strain between US and Russian relations. In the event that Russia does not make a deal in 50 days, we could see more cyber activity, similar to what we saw in the onset of the war with Killnet and these Russian Nexus hacktivist groups that, to attack the US and NATO, would target critical infrastructure owners. And under the critical infrastructure owner umbrella, health sector organizations live. So that would be some indirect risk to health sector organizations from these hacktivist groups. And depending on the scale of attacks or the sophistication of weapons delivered to Ukraine, these hacktivist campaigns could also scale in aggression with more sophisticated and advanced weapons deliveries to Ukraine, more aggressive hacktivist campaigns targeting healthcare and critical infrastructure. Next slide, please. And then some miscellaneous geopolitical developments. Interpol has identified West Africa as a potential new cybercrime hub. So Southeast Asian cybercriminal gangs and scam centers and fraud have been globalizing. And according to research done by Interpol, it looks like they are expanding into the West African region. Chinese biotech companies are really expediting their research and development capabilities right now. So be on the lookout for possible Chinese cyber espionage as the competitiveness between Chinese and NATO biotechnology companies ramp up. Lastly, the remote IT workers from North Korea continue to be a thorn in the health sector side. So kind of as we were talking about earlier, definitely brokering connections between cybersecurity and HR teams. And that should sum it up. Thank you. If anyone has any questions, I'd love to take them.
All right, awesome update there, Ethan. Thanks so much. Yeah, I always need to pay attention to what's happening globally in issues like this because you never know where we're going to see some fallout in the cyberspace. All right. All right, we've got one more question that we'll work in on here in a moment. And with that, we'll go ahead to our next speaker. So over to Jeff Mann, who will talk about physical security.
Thanks, Errol. So if we want to move to the next slide, uh, natural disasters have been growing in severity and frequency, especially in this last quarter with wildfires and moving into hurricane season. But we've also had some severe impacts from flooding that may continue to occur in the coming months. So we want to focus on that. So particularly even just this month. So I'm sure everyone is familiar with the severe flooding that happened earlier in Texas. And these numbers have been updated since then, where the death toll has risen to 135, but the missing count has been reduced to 100. Oftentimes, after a natural disaster, people are reported missing as an overcaution, but the numbers are not realistic. New Mexico, just afterwards, had some severe flooding. You can see in the images on the slide this picture on the far right of the house. It's actually flowing down as if it were in the middle of a river. That's how drastic the floods were. But thankfully, there were very few deaths associated with that. Um, July 13th, I'll skip a little bit there. Texas had even more flooding that had significant impacts on the search efforts that were occurring with the original flood of the Guadalupe River, where it was difficult to continue the rescue operations and search operations. And Chicago and New York, both big cities, had major flooding issues that flooded the roads. You can see this picture here on the bottom left. That is of New York. So a lot of severe flooding that impacted areas that do not generally have this kind of issues, which makes the impacts more severe as their infrastructure is not necessarily prepared to handle it. And those floods in New York also stretched across New Jersey and Pennsylvania, the tri-state area. Next slide. So flooding can have significant impacts to health sector, not only in the facility as is depicted by these images, but also there are secondary and tertiary effects that can impact the health sector due to floods. So power outages can occur locally, or it can impact the whole area. You may have uh, flood waters impacting electrical substations that can take out a whole sector of the grid. And even if a facility is not impacted by the flood waters directly, can have water issues, electrical or power issues, electrical hazards. So water impacting power supplies or getting into generators can cause issues where the water now has become a hazard if it's impacting open electrical wiring. Damage to structures and devices. Medical devices may not survive being submerged if they're in a part of the facility where water has impacted. And obviously, long periods of time with water can waterlog structures and cause damage to the overall facility as it stands. Uh, there have been cases in the past where flood waters coming at a fast rate, flash flood, can trap occupants, no time to evacuate or move slow-moving patients or patients that may not be able to move themselves, and also trapping staff as well. Tainted water supplies. So this may impact a direct facility, but can also be flood waters have risen over where a water treatment plant may be, and now the whole area's water is unusable. Uh, Telecommunication disruptions that can be impacted by power outages, but also just facilities that are specific for telecommunication can be impacted by floodwaters. And then this can also cause extended downtimes, as in your facility may not be able to operate properly, you may need to evacuate, and it could impact a facility that's supporting an evacuated facility. If you're taking on new patients with limited beds, it may impact your operations while trying to support. Next slide. So recommendations, if you have forewarning of a flood, such as in a hurricane situation, water barriers have proven to be very effective. You can see a picture of some temporary barriers down here on the bottom left. Submarine doors are also being more popular in areas where floods are more likely, and those can be used in a more immediate sense if you have a little bit of forewarning as in there's a flash flood happening or may happen in the near future. You can use these submarine doors to secure facilities. It doesn't necessarily have to be as big enough to protect your whole operating area. You could also have some submarine doors specifically just for generator areas to protect your electrical powers. Evacuation obviously is an option if you have enough time and enough reason to believe that you may be impacted. And then for future planning, when building facilities, try and select locations that are higher elevations so that there is a less likelihood of water levels rising to impact your facility. So on the right here, there's some descriptions of some different programs that are available. There's the Hazard Mitigation Grant Program, which is meant to be taken advantage of after a disaster. It doesn't have the hazard mitigation doesn't necessarily have to be specifically for floods, but is very good to be used for. You cannot apply as a facility, your community must apply for it. So you have to have some type of coordination with your local government. Um, and you must have a presidentially declared disaster. So, but this is the intent of rebuilding, but also using funds to make your facility more likely to be able to sustain through one of these events in the future. And then there's the FEMA Hazard Mitigation Grant Program, which is something that you can use to get funding for mitigative uh, uh, additives to your facility, something that can help you, like building in those submarine doors and things of that nature. And you can Google all of these. They all have different requirements, but they're all something that you can apply for if you think that your facility may be at risk and you need some extra support to plan for it. And with that, I will stop for questions and pass it back.
All right, great, Jeff. Thanks for all the updates. No new questions. So with that, we'll keep moving. John's already here. Great. John Banghart from Venable. Thanks so much for being here. Really appreciate your support on this, and over to you, sir.
Thanks, Errol. Am I coming through okay?
Perfect, perfect.
Okay, great. Thank you. Well, good afternoon, everyone. As Errol said, my name is John Banghart. I'm a senior director with Venable LLP. Unlike some of the other briefings that you've had today, this is a little bit less about threat and maybe more about awareness. As you might expect, it's never a dull moment in Washington, D.C. The U.S. government policy landscape is in a lot of flux. And so my goal today is to help just give you some insights at a high level into some of the things that are happening and hopefully give you a little bit of a sense of where you can plug in and what it's going to mean to you in the future. So next slide, please. So we'll start with the Trump administration. So we'll start with the executive branch. I'll talk a little bit more about Congress here in a minute. There's been quite a bit that's been going on. Obviously, when President Trump came into power at the beginning of this year, there's been a lot that has happened just government-wide. But we are now starting to see more, particularly starting in this past June, starting to see a little bit more now happening on the cybersecurity front. There were a lot of things that the administration was focused on and continues to be focused on, but we are now starting to see the administration lean a little bit more into cybersecurity. Part of where that started was a new executive order back in June. That's Executive Order 14306. We expected that this would be a fairly lightweight adjustment over the Biden era cybersecurity executive orders, excuse me, and that is in fact what happened. There were not a lot of sweeping changes in that executive order. A lot of the key administrative programs defined again during the Biden administration were maintained, at least at the executive sort of White House level. Now there have been some other changes that we'll talk about. There were, however, some strategic cuts to a number of federally funded programs. Obviously, we've seen cuts at CISA, elsewhere across DHS. Some of the impacts of that have started to be felt with some of the more recent wide-scale incidents and some challenges in terms of coordinating with CISA, which is not to say that the folks there aren't doing an absolutely stellar job. They are, but they have been had their numbers reduced, they've had their funding reduced, and so we're kind of continuing to see how that's going to play out. There have been changes elsewhere that I'll touch on as well. There was an emphasis on software supply chain. So that was an emphasis also during the Biden administration that has now been continued in the Trump administration. And we'll continue to see how that plays out. Some of it is playing out from an economic perspective, right? Tariffs, trade embargoes, and so on. But there are going to be other things related to, secure software design, again, which are things that have continued and will continue, we expect, to be a focus for this administration. A lot of promotion of AI. And I don't have it in the slides because it just came out today, but there is a new AI action plan that was just released this morning. You might want to take a look at that if AI is important to you, and I suspect that it is. There are some interesting things in there. For example, they plan on creating an artificial intelligence ISAC. Just like we have a Health-ISAC, we're going to have an AI ISAC. An interesting part about that one is that it'll actually be jointly run by ONCD, which of course is part of the White House. And so that's sort of a different model than we've seen with some of the other ISACs. So breaking news there. So I don't have a lot of details, but you can go and find that. But the previous executive order did make it clear that ONCD, the Office of the National Cyber Director, was going to play a key role. And so we have seen that not only with this new AI action plan, but in other places as well. Next slide, please. Key appointees. So again, the administration came in with a pretty key focus in some areas. In others, they put up nominees, but they just haven't sort of gotten around to it. We are very, very close. I promised this time to getting Sean Cairncross, who was nominated to head up ONCD. We expect that he will get approved by Congress here shortly, as well as Sean Planky over at CISA and some others. So some of those positions are now being filled or starting to be filled formally, which will help. If you've ever worked in the government, federal, state, whatever, you know that when you don't have a formal appointed leader of an agency, it can often slow things down because people who are acting, who may know they are temporary, don't often want to rock the boat or make any major decisions. So getting some of these folks in place is going to be super important. Already touched on the new cyber executive order. Just as a general matter, this administration is sort of, I won't say anti-regulatory, but certainly less inclined to regulation than the previous administration. And so we are starting to see some of that roll back, some of it as an impact to just reducing staffing at agencies for enforcement purposes, but also looking at how can we roll back some of things like the SEC requirements and so on. This will also, I think, impact the new HIPAA security rule. We don't know that for certain yet, but I do think that much of what was in the new HIPAA security rule, it seems less likely that that's going to go forward in its current form. So plenty to keep an eye on there. Government hiring freeze has been extended in a lot of places, not everywhere. But a lot of additional firings have gone forward. You may have seen a week or two ago, over 1,000 folks were let go from the State Department. That included a number of cybersecurity diplomats, so people who seek to both represent the U.S. on the international stage on cybersecurity matters, as well as attempts to influence cybersecurity policy internationally to our benefit. Many of those folks are now gone. So it'll be interesting to see, if those get filled or how that gets restructured. And of course, the Department of Education is slated to be effectively just eliminated entirely. So it'll be interesting to see how that goes. So next slide, please. So turning next to Congress, so that was the executive branch. Turning next quickly to Congress, there's a lot of activity happening there, particularly on the healthcare front. A lot of discussion around rural hospital security. That discussion is a great thing, right? It is a topic area that I'm sure all of you know has been of grave concern for a long period of time. We don't have a lot of certainty on where Congress is going, but not only is this become an issue for Congress, and you can see there's some bills out there that are being proposed in an effort to help rural hospitals, rural healthcare, but also some of the leadership when Sean, I believe it was Sean Cairncross, or it might have been Sean Planky, when they were getting interviewed by Congress, they were asked about the importance of rural healthcare and flagged that as an important issue. So I expect we're going to see quite a bit there around healthcare. Now, these are all just bills at the moment. They still have to go through that whole process, and given the legislative season is going to come here to an end before too long, I don't expect we'll see a ton happening. But the fact that these things are being discussed and appear to be relatively nonpartisan, at least the healthcare parts of them, is a positive sign. And so I think we may see some additional help, if you will, for rural healthcare. quickly touch on CISA 2015, the Cybersecurity Information Sharing Act of 2015. I won't go into the whole backstory on this. We've written some hacking healthcares that you can find on the Health-ISAC website. Plenty of other people have spoken about it as well. But this is a major act from 2015 that empowered a lot of great information sharing, not just among the ISACs and its members, but with government as well. That's set to expire at the end of September. There's been a number of positive movements recently. So I think that there's going to hopefully be a last minute sort of reconciliation that will allow CISA 2015 to be renewed in some form. But we're keeping a close eye on that one. It could have some major impacts. I mentioned the HIPAA update. There's a lot going on there. I don't know how much of that's actually going to survive. And of course, we have just the general budget appropriations where we're still working through the presidential budget. Okay, one more. Next slide, please. So I think just generally, we're going to, yeah, there we go. Thank you. I think just generally what we're seeing already and what I think we will continue to see is an acceleration around cyber policy and regulatory developments as well as decreases. There's obviously a lot happening on the cyber front. A number of folks already during this briefing today have talked about a number of reasons why cyber hostilities may increase. And so I do think that this administration and I do think Congress is getting maybe a little bit more serious about it than they have been in the first few months of this year. So that's good to see. I think we do need to have that sort of attention. It's important for all of us in the private sector to continue to engage with our policymakers to help them understand the challenges that we're faced with and help guide them in terms of making the right kind of policy decisions. But I do think we're going to see quite a bit more of that across all critical infrastructure sectors, certainly healthcare, as we've already touched on. So again, my recommendation, where you can, whether it's through Health-ISAC, sector coordinating councils, American Hospital Association, whatever sort of reach you have, it's so important to communicate about the risks you're facing and the kind of needs that you need in ways that policymakers can understand. They do need to hear it. They do need to be educated. You cannot assume that your policymakers at any government level understand the issues that you're faced with on a day-by-day basis. So making those communications to them is actually really important. And my screen turned off, so hopefully you can still hear me. There we go. All right, and then finally, the budget appropriations I mentioned, same thing. Keep an eye on that. That's going to continue to be debated. There's a number of pieces to it. We don't have to go into all of the sausage making, but we're going to see more, right? This is going to continue, and hopefully, if I am invited back for next quarter, we'll have quite a few new updates as well. So with that, I'll stop. Happy to entertain any questions. Otherwise, Errol, back to you.
Yeah, John, really appreciate all that. I know a lot of great information. Don't go anywhere yet.
Okay.
Really appreciate you covering all of that and helping us stay on top of all of these developments. It's super important. Question did come in. I know you talked a little bit about this, but what do you think the chances are that any kind of revised HIPAA guidelines would come out this year, next year, et cetera?
I think next year, yeah. This year, I would be skeptical. I mean, you never say never, right? Because these things can change on a dime.
Right.
I've worked in this town long enough to understand that. But I think next year is probably pretty likely that we will see something. I think we don't quite know yet, and what we're anxious to learn is what will those revised HIPAA guidelines look like, right? I mean, we know what the proposed HIPAA security rule is. We know that that was put on hold, and we know that there hasn't necessarily been a ton of work on it since it was put on hold. So I think that process will be re-engaged. I think we'll have an opportunity to chime in, but I would not expect to see any real movement until next year. But don't hold me to it.
Right. And we know that, there were plenty of comments received during the open period and
That's right.
whatnot, including I know the Sector Coordinating Council put together quite a response as well, and other
Mhm.
organizations did too. So hopefully all of that will be under consideration.
Exactly.
Okay. All right, John, really appreciate everything. Thanks for being
Great.
here.
Thank you. Of
And we will
course.
move to our next speaker. We're off to Vasilios Mingos, who is Health-ISAC's European Operations Director. So we did a lot of catching up about the US there. So Vasilios, what's happening in Europe?
Thank you, Errol. So hello, everyone. As Errol said, I'm Vasilios Mingos, the European Operations Director for Health-ISAC. So we're going to talk about the European Cyber Watch. And with this segment, we aim to give an overview of the incidents and events that are relevant for Europe, including those that are affecting healthcare, critical infrastructure, and of course, government agencies, as well as the general geopolitical events. Due, of course, to time constraints, we will only list a couple of these for each category. So let's start. For general cyber incidents, we can start with the pro-Russian hacker group named no-name 057, which launched the distributed denial of service attack, DDoS attack, on the state portal of Saxony-Anhalt in Germany, which made several ministry websites temporarily inaccessible for a few hours. The attack was confirmed by a spokesperson for the Digital Ministry of the State, and later the news agency DPA was informed. The IT service provider, that Dataport, which also serves for the public administration in Hamburg, Bremen, and Schleswig-Holstein, reported no disruptions in these regions. Then we have another DDoS attack. A DDoS attack targeted the website of the German city of Nuremberg, disrupting access to its online services, authority guide, and contact form. City officials stated that no citizen data was compromised and that the attack originated externally. This marked the second such incident following a similar attack back in April. While updated security measures were still being implemented, the city filed a criminal complaint and involved the cybercrime unit of the Nuremberg police. And the third incident includes an unidentified hacker group which launched a ransomware attack on the Adige Po Reclamation Consortium in Italy, which manages the network of canals and hydrovores in the region. The attack was promptly identified and contained by in-house technicians with support from external cybersecurity experts brought in to neutralize the threat. While the incident led to the encryption and the theft of some digital files and archives, it did not disrupt the operational control units or hydrovores in the field. Now, moving on to relevant breaches, we have the following. An unknown hacker stole sensitive files from the private hospital of Lower HPL in July 2025, compromising patient data, including names, dates of birth, social security numbers, and contact information. The hospital filed a complaint and notified the National Commission for Information Technology and Freedoms, and on the 10th of July 2025, the hospital started to inform more than 126,000 patients that are affected by the hack. Then we have the cyber criminal group called Sarcoma that claimed responsibility for a ransomware attack on the Zurich Public Health Foundation Radix, allegedly stealing around 2 terabytes of sensitive data. Radix is a Zurich-based non-profit organization that is dedicated to health promotion. The Swiss government confirmed that Radix's customers include various federal offices that might also be affected. The attackers published screenshots of allegedly stolen documents, and the exact nature of the compromised information remains unclear. At the end of June 2025, the hackers published the data on dark web. Next one, we have Russian-speaking cybercriminal group Kilin launched a cyber attack against French semiconductor company Semco Technologies. The company confirmed the breach and took measures to limit the damage. Now, despite the intrusion, equipment operations were not disrupted, nor was the company's successful Euronext stock market debut on 4th of July 2025, which raised 45 million euros. Kilin later claimed responsibility and published stolen employee data online, including passports and invoices, likely seeking financial gain. Lastly, following some of the geopolitical developments, we have the following. Since the ceasefire deal went into effect on June 24, 2025, Iran has pursued 2 escalatory courses of action that could result in further strikes or military action from the West. First, Iran had stopped cooperating with the International Atomic Energy Association. Second, new intelligence has surfaced that Iran has prepositioned to deploy naval mines in the Strait of Hormuz to form a blockade, which would pose serious issues of as roughly 20% of global oil and a significant portion of natural gas pass through the strait. Then we have that on June 2025, leaders of the 32 NATO member states officially endorsed a new defense spending target of 5% of GDP by 2035. The allocation includes 3.5% for core defense expenditures, such as personnel and weapons, and 1.5% for related security areas like cybersecurity and infrastructure. This marks a significant increase from the previous 2% target established after Russia's 2014 annexation of Crimea. The new target is seen as a major diplomatic win for the US and aims to strengthen NATO unity while enhancing European defense capabilities against potential threats from Russia. And lastly, a US Department of Justice investigation uncovered a sophisticated North Korean state-sponsored operation involving 29 laptop farms across 16 states where North Korean IT workers used stolen identities to fraudulently secure remote jobs at over 100 US companies. These workers, aided by US-based accomplices, accessed sensitive data, resulting in at least $3 million in losses and the compromise of confidential information. 4 North Korean nationals and a US citizen have been indicted for their roles in the scheme, and the operation relied on complex financial maneuvers to launder proceeds and evade detection, highlighting the evolving tactics of North Korean cyber actors. The operatives who participated in the scheme are reported to send 85 to 90% of their salaries back to North Korea to fund weapon development programs. As for recommendations, Health-ISAC advises to stay vigilant over regional cyber threats relevant to Europe and to monitor geopolitical developments as these events impact our sector heavily. That is all for me, Errol, and I'll pass it back to you. I remain available for any questions.
Okay, great. Thanks, Vasilios, for all those updates. Great to hear the perspective. No questions, so we can keep going. Our last speaker is going to be Trey Darrisaw on significant global dates. So what do we need to watch out for?
Hi, thank you, Errol. My name is Trey Darrisaw, and I will be presenting the global and significant dates for August. To determine these global dates to be significant, it may see an increase in the number of activities or attacks from threat actors. Starting off, we have Hiroshima Day, August 6th, observed in Japan. After that is International Day of the World's Indigenous People, celebrated worldwide on August 9th. Following that is World Humanitarian Day, on August 19th, also celebrated worldwide. Then we have Day of Medical Transporters, August 20th, celebrated worldwide. And then we have International Day of Remembrance and Tribute to Victims of Terrorism on August 21st. And then finally, there's Women's Equality Day, August 26th in the United States. With these dates, we bring situational awareness to them as they may see an increase in the number of attacks. As we've seen in recent years, significant dates pose a risk for these attacks as individuals have additional downtime, and that completes global significant dates. If there are no more questions.
Great, Trey. Thanks a lot for all those updates. Appreciate it. No questions in there. I've got just a couple of reminders and some other announcements to run through here. And while I'm doing that, if you do have any questions or any comments that you wanted to share, you can go ahead and enter that into the questions panel. I'll take a look at that before we close out. So my first set of reminders is we have some upcoming events. We have 2 summits and some workshops coming up. On the summits, really excited to say that we'll be in Rome, Italy in mid-October. Registration for that event is currently open. So if you have any of your staff are located anywhere in Italy or Europe for that matter, and have an opportunity to attend, it would be great to have them there. Again, the registration is open, and more information on our website. And then our next summit in the US will be held in Carlsbad, California, the first few days in December. And you can see the dates there. Registration is not open for that yet. It should be open any day. Just keep an eye out for that. But again, if you're planning to potentially come, or if you have staff that you want to attend as well, you can start the planning for that as well. More information about that on our Health-ISAC webpage. Nicole, next slide. And then in terms of workshops, there's a few workshops coming up, different regions across the U.S. and internationally as well. First one at University of Washington Medicine in Seattle on July 29th. Next one is in Sao Paulo, Brazil at Albert Einstein Hospital, hosted there on September 9th. And then the last one this quarter, Thermo Fisher hosting in Frederick, Maryland on September 25th. So again, if you're interested in attending any of those, or if you have staff in any of those areas that you think might be interested, all of that information again is on our website, and there are those workshops are no fees associated with that to attend. So we'd love to have you there. All right, and the next slide, just again wrapping things up, taking a look at the questions. No questions, so we'll go ahead and wrap it up. Again, really appreciate all of you attending. I saw about 110 people on the webinar at one point today, so really glad to have you here. I would ask that if you have any comments, feedback, any questions about today's presentation, you can please send a note to contact@hisac.org. Super helpful for us in terms of being able to continuously improve what we're providing here for you today, and make it better, make possibly even suggestions for topics for future events as well. So really appreciate the feedback, and we take all of that very seriously. I'm seeing a bunch of thumbs up and some comments in the questions box about the value of the presentation today. So great to see that. Please put a hold on your calendar for the next version of this. Next quarter will be on October 8th at noon Eastern. And with that, I want to thank all the presenters today. Really appreciate everybody coming together to provide the information. And with that, we can close out today's presentation. Thanks again for attending.